स्टार्ट। हाँ, लोअर लिम का आज और ओवर आज आखिरी लेक्चर है। तो ये देखें, फर्स्ट ऑफ ऑल वी मस्ट हैव टू नो व्हाट इज ए नी जॉइंट। तो प्लीज रिमेंबर, नी जॉइंट इट इज one of the, you can say, the largest joint and one of the complicated joint. Okay, so this is your knee joint here, which is showing you in the picture, and this is the complete whole picture of the knee joint. ये देखें, so this is your knee joint now. Joint open, knee slightly in flex position. So first of all, you must have to know what is the knee joint itself. So please remember, knee joint, it is a condylar type of वैसे तो ये synovial joint है. Okay, so it is, you can say, condylar joint of synovial type. Synovial joint के condylar type है. Okay, synovial type. Okay, and how it is going to form? See here, it is a this joint is forming between the articulation between the condyles of the femur bone. So see here, these are the condyles of the, see here, these are the condyles of the femur bone. Okay, so this is the medial condyle of the femur bone. This is the lateral condyle of the femur bone. Okay, so it is forming between the condyles of the femur bone and the tibia bone. यहाँ पे नीचे it will be the tibia bone, between the condyles of the femur bone and the tibia bone. Okay, so and जो joint बनेगा between the patella and the femur. So this is your patella bone. Okay, so this is the patella bone. So the joint which is forming between the patella and the femur bone, that is a saddle type of joint. इसका joint का नाम है saddle joint. Okay, and please remember that this patella, it is the largest sesamoid bone. So this is the largest sesamoid bone. Okay, so it is the largest sesamoid bone, and it is present in this tendon. Okay, so what is the name of this tendon? See here, everyone. So this is the quadratus femoris tendon, which is present in front of the knee joint. It is this tendon. This is the quadratus femoris tendon, and now it is having this patella bone as a sesamoid bone in the tendon of the quadratus femoris muscle, and now it is going to join here at the tibial tuberosity. और अब इसका जो नाम हो जाएगा, now it is going to call it as the patellar ligament. Okay, so this is now known as the patellar ligament. Okay, so this is your knee joint. So when knee joint is stable, जब आप लिखते हो ना कि the knee joint is stable, so it means what? It means that it is extended fully, full extension. So it is extended fully, and it is done by which muscle? The name of the muscle is quadriceps femoris muscle. And if you want to unlock this knee joint, a muscle is present. Unlock the knee joint, a muscle is present which is present behind the knee joint. जो अभी इस पिक्चर में नजर नहीं आ रहा, that is your popliteus muscle. Okay, so when the knee is fully extended, it is formed by the it is done by the quadriceps femoris muscle. And if you want to unlock the knee joint, you have to use your popliteal muscle now. Now see here this one now. So this knee joint, please remember there are many ligaments are present here. So first of all, we must have to discuss the ligaments. So see here, uh, number one important point. First of all, you must have to write like this one. Uh, 1 second. So whenever you are writing the knee joint, see here. knee joint. There are some, you can say, ligaments which are intracapsular, and there are some ligaments which are extracapsular. Okay, so some ligaments are intracapsular, some ligaments are extracapsular. Okay, but first thing what you must have to remember, you must have to identify all the ligaments. So see here, the ligament which is going to come from the, for example, this is our, this bone here, this is the fibula bone. This bone present here, this is your tibia bone. So tibia will be present medially, and the fibula will be present laterally. Okay, so one ligament is going to cover here like this one, which I draw here in the diagram like this one. This ligament, because it is present laterally, तो आप इसको नाम दे दोगे lateral collateral ligament. Lateral collateral ligament. Okay, so this is your which ligament? The lateral collateral ligament. Or you can also call it as lateral fibular ligament because it is attaching with the femur bone and laterally it is attached to your fibula bone. Second ligament which is present here between the condyles of the, you can say, the femur bone and the tibia bone, that is known as medial collateral ligament. Okay, so medial ligament and lateral collateral ligament. Okay, so medial ligament and collateral lateral ligament. Okay, so first see here these two ligaments, lateral collateral ligament and medial collateral ligament, they are extracapsular. Okay, so these two collateral ligament, medial collateral ligament को आप medial tibial collateral ligament भी लिख सकते हैं. You can write it like this also. So please remember that lateral collateral ligament and medial collateral ligament, these two ligaments are extracapsular. They are outside the joint. Extracapsular ligaments. Okay. Now coming into the inside of the joint. So inside of the joint, see this one now. A meniscus, a fibrocartilage structure is present between these condyles of the femur bone and the tibia bone. So if it is present medially, it is known as medial meniscus. If it is present laterally, it is known as lateral meniscus. So medial meniscus, lateral meniscus. Okay. And along with these two meniscus, see here, one ligament is coming in this direction, which you can see in the, this is the anterior side of the, you can say anterior side of the knee joint. So you can easily visualize this ligament anteriorly. So this is known as anterior cruciate ligament. So anterior cruciate ligament, and that another ligament which you can see posteriorly, but it's not visualized here. That is your posterior cruciate ligament. Okay. So anterior cruciate ligament, posterior cruciate ligament, medial meniscus, and lateral meniscus all are your intracapsular ligaments. They are present inside the knee joint. Okay. Medial meniscus, lateral meniscus. Please remember they are fibrocartilage. They are your fibrocartilage. Okay. They are your fibrocartilage. Okay. So now we have to see another picture of the knee joint now. Now see this picture now. This is the lateral condyle of the femur bone. This is the medial condyle of the femur bone. So on the medial condyle of the femur bone, see here, you have tibial collateral ligament. So tibial collateral ligament को आप क्या लिख सकते हैं? You can also write it as medial collateral ligament. On this side here, you have fibular collateral ligament, or it is also known as lateral collateral ligament. So these ligaments are present outside the joint. Okay, and then you have this anterior cruciate ligament, ACL. This is very, very important. And posterior cruciate ligament, PCL. These are present also, they are present intracapsular. Okay, so medial collateral and lateral collateral, they are extracapsular ligaments. ACL and PCL, they are intracapsular ligament. Okay, they are your intracapsular ligament. So what you must have to remember, I will explain anterior draw sign and posterior draw sign and Leishman test. I will explain also, no need to worry. First इसकी anatomy हो जाए एक दफा, then I will explain these things. Okay, so now you are looking at the knee joint superiorly. So see this one. This is the lateral meniscus. Lateral meniscus. And this is the medial meniscus. Okay. So if you want to draw here one diagram of yours, so you can easily draw the diagram like this. Please draw this diagram with me, everyone. So mnemonic will be like this: MCL and LMC. Okay. So it will be like this: MCL. M is what? M is your medial collateral ligament. Okay, it is your medial meniscus. Sorry, this is your medial meniscus. Medial meniscus. Okay, C is your what? C is your ACL, anterior cruciate ligament. L and L is what? This is your lateral meniscus. Lateral meniscus. It is like this one. So this is your lateral meniscus and lateral meniscus. See here in this diagram. So this is your lateral meniscus. Okay. So lateral meniscus is coming inside. M is your what? M is your medial meniscus, like this one. Okay, इस तरह आपका medial meniscus होगा. And C is your posterior cruciate ligament. So see in this diagram. अब मैं आपको इस diagram पे ये दिखा देता हूँ. First of all, see this diagram. Then you can understand what I am trying to explain to you. Because you must have to understand these ligaments. So see this one. This is the most posterior side and this is your posterior cruciate ligament. So this is your PCL. Okay. This one most anterior structure. Okay. This one here. So this is your, this one. No, not this one. This is your anterior cruciate ligament. And now you must have to understand the menisci, which are your fibrocartilages. So fibrocartilages, see here. This is your medial meniscus. And this one here, like this. This is your lateral meniscus. So if you want to understand it like this one, so you can draw the diagram like this. MCL, LMC. So C is the most posterior structure is your posterior, you can say collateral ligament. Okay, most anterior, this one is your ACL, anterior cruciate ligament. So this is posterior cruciate ligament. This is anterior cruciate ligament. This one here, this is your lateral meniscus now, like this. So you can draw this diagram like this. So this is the lateral cruciate ligament. Okay, and then this is the medial meniscus now. So medial meniscus will be like this. Okay, like this. So this is your medial meniscus now. Okay, so see here, medial meniscus, then anterior cruciate ligament, then lateral meniscus, and then again this is your, see here, medial meniscus coming out here, and then the most posterior structure, that is your posterior cruciate ligament. So if you remember this sequence, Medical College Lahore or Lahore Medical College, you can remember it forever. Okay. So this is how you can understand the structure. See here, This is the posterior cruciate ligament now. Okay, posterior cruciate ligament. And this is the anterior cruciate ligament. So you must have to understand like this. Okay. So see here, Medical College Lahore, Lahore Medical College, like this. Okay. So what is M in medical college? It is the medial meniscus horn. Then C is your what? C is your anterior cruciate ligament. L is your what? L is your horn of the lateral meniscus. Okay. Then this again, L is again what? It is again your horn of your uh, lateral meniscus. Lateral meniscus. Okay. Then you have M structure. M is your what? M is your medial meniscus horn. Medial meniscus horn. Okay. And then the most posterior structure, this C is your posterior cruciate ligament. So you can now easily see in this video, the mnemonic is Medical College Lahore, Lahore Medical College. So if you remember this sequence, you can never ever make a mistake here. Okay. And please remember one very important point. And this line, I want all of you to remember it forever, that ACL and PCL both are present intracapsular. Both are your intracapsular ligaments, right? But they are intracapsular, but they are extrasynovial. Extrasynovial mean that synovial joint is, ये synovial joint से थोड़ा सा बाहर है. Okay? And when they are extrasynovial, please remember they are lined by synovial membrane completely for ACL and partially for PCL. I
बंदे
will
मैं
draw
हेडफोन
one
चालू कर
diagram and
दिया
then you can understand this statement.
था
Now see, now see here, I draw one diagram and you will understand then now. So see here. First of all, for example, this is the synovial, this is your capsule of the joint. This is the capsule of the joint. Capsule of joint. Okay. And now inside here, this is the synovial membrane now, which I am drawing in red color. So this is the synovial membrane of your knee joint, like this. So this
लेफ्ट अगर उड़ा वो हॉटस्पॉट शोएब बताओ हॉटस्पॉट उड़ा
हॉटस्पॉट रोड़ा, मैं बता देता हॉटस्पॉट रोड़ा. Synovial membrane. So this is the synovial membrane. And now we must have to understand where your ACL and PCL is. So see here, this is your ACL, anterior cruciate ligament. So see here, ACL and PCL are intracapsular. They are inside the capsule of the joint. Okay. So they are in the capsule, intracapsular of the knee joint, but they are extrasynovial. So this is the synovial membrane. Why it is extrasynovial? See here. It is lined by the synovial membrane completely by the anterior cruciate ligament and partially for PCL. So PCL के देखें posterior side पे, it is not covered by the synovial membrane. It is clear to everyone. So it is deficient for PCL posteriorly. Deficient for PCL posteriorly. Please remember it forever. Students will make here the mistake. Okay. This is the important concept which you all must have to remember. Now see this diagram now. Now we must have to understand this diagram. See this one. This is your fibular collateral ligament, or also known as lateral collateral ligament. This is your tibial collateral ligament, or also known as medial collateral ligament. Now see here, ACL. What is ACL? ACL is coming like this. So this is your ACL, which I am highlighting in the red color. Okay. So why ACL is present? It is going backward, upward and laterally. तो ACL के लिए आपने निमोनिक याद रखना है. ACL के लिए निमोनिक is able. It is going up, backward, upward and lateral. For PCL, this is the PCL which I am drawing in green color. This is the PCL. PCL. So PCL is present anteromedially. PAM. PAM. So now see this picture now. See? So this is your posterior cruciate ligament. You can better visualize the posterior cruciate ligament posteriorly. It is present anteromedially. Okay? This is your posterior cruciate ligament. This one. But this is your, see, anterior cruciate ligament is coming from the anterior side, and now it is going backward, and now it is attaching here to the lateral condyle here. So this is your anterior cruciate ligament. Okay. So anterior cruciate ligament, please remember, it is going backward, backward here. It is going backward, upward and lateral. And now it is attaching here to the lateral condyle of the femur bone. Your PCL, it is present anteromedially, that's it, and attached to the your medial condyle. So it is present anteromedially, but your ACL, it is coming out, see here, back, it is going backward, upward and lateral and attaching to the lateral condyle. Okay, clear to everyone? This is clear to everyone? So ACL, please remember, what is the function for ACL now? ACL. So it is starting from the letter A. Okay, okay. It is starting from the letter A. So ACL will prevent, it will prevent what? Posterior displacement of femur and prevents anterior displacement of tibia. Because it is ACL, so it will prevent anterior displacement of tibia. और इसको आपने उल्टा कर देना है, prevent posterior displacement of femur. But when you are writing the PCL, not change it completely. PCL will do what? It will prevent anterior displacement of femur and posterior displacement of tibia. Okay? And posterior displacement of tibia. Okay? So anterior, तो इसी को हम बोलते हैं anterior drawer sign now. So what is anterior drawer sign? You will place the patient to check for any tear in the ACL. Tear in the ACL. That is known as anterior drawer sign. I am telling you, no need to worry. So anterior knee examination, whenever you are performing knee examination, please remember, you in anterior drawer sign or posterior drawer sign, you have to place the knee at 90-degree angle. You have to place the knee at 90-degree angle. 90-degree angle. Sometimes it can be painful. To prevent that, they make another test that is known as Lashman test. Lashman test is the same as your anterior and posterior drawer test sign, but the difference is here you are going to place the knee at 30-degree angle. बस ये फर्क है. But see here, if patient is having rupture of the anterior cruciate ligament, what will happen? Okay, so what will happen? The tibia anterior ACL का function क्या है? To prevent anterior displacement of tibia. So when there is any damage to the ACL, what will happen? The tibia is going to displace anteriorly. And when tibia is going to displace anteriorly, आप कह दोगे जी anterior drawer sign is positive. That's it. What is posterior drawer sign? Posterior drawer sign is for your posterior drawer sign. It is for your PCL. PCL का what is the function? To prevent posterior displacement of tibia and anterior displacement of femur. जाहिर बात है अगर डिस्प्लेस टिबिया पीछे की तरफ जाएगी तो जो फीमर है वो ऑटोमेटिकली एंटीरियरली चली जाएगी, या अगर एसीएल में अगर टिबिया जो है वो एंटीरियरली डिस्प्लेस हो रही है तो ऑटोमेटिकली फीमर जो है पोस्टीरियरली चली जाएगी. तो पीसीएल क्या है? पीसीएल है, प्लीज रिमेंबर, इट इज प्रिवेंटिंग पोस्टीरियर डिस्प्लेसमेंट ऑफ टिबिया. So in posterior drawer sign, what will happen? The tibia is going to displace posteriorly. तो अगर tibia जो है it is going to displace posteriorly, you are going to say, sir, this is the positive posterior drawer sign. Clear to everyone? So if there is a PCL tear, यहाँ पे if there is a PCL tear, there will be positive drawer sign. If there is a ACL tear, there will be positive anterior drawer sign. Okay, so ACL का function क्या है? To prevent posterior displacement. Please remember it forever. This will be your first answer, not this will be your first answer. Posterior displacement of femur is your first answer. How you can remember it? How you can remember it? Anterior cruciate ligament, it will prevent anterior displacement of tibia, और उसी का बिल्कुल opposite कर दो, posterior displacement of femur. But if anyone is going to ask you, first answer will be posterior displacement of femur, second answer will be anterior displacement of tibia. But if there is a patient who is having injury and tear in the ACL, anterior drawer sign is for ACL and posterior drawer sign is for PCL. Yes. So if there is a patient who is having a tear in the anterior cruciate ligament, you are going to check the anterior drawer sign. And anterior drawer sign जब आप करोगे, you will place the knee at 90-degree angle. You will place the knee at 90-degree angle, and when you place the knee at 90-degree angle, you are trying to push the tibia anteriorly. And if the patient and tibia is going to displace anteriorly, क्योंकि ACL का काम क्या है कि इसको प्रिवेंट करना, तो अगर पेशेंट में ACL रप्चर होगा, टीयर होगा, तो इसमें ऑटोमेटिकली जो टिबिया वो डिस्प्लेस कर जाएगी एंटीरियरली. तो आप कह दोगे सर patient is having anterior drawer sign which is positive. Clear? Now coming into the PCL. PCL is your posterior cruciate ligament. And what is the function of PCL? It will prevent anterior displacement of femur and posterior displacement of tibia. तो PCL का काम है इसको प्रिवेंट करना. किसको प्रिवेंट करना? Posterior displacement of the tibia. So if you want to check posterior drawer sign, again you are going to bend the knee at 90-degree angle, and when you bend the knee at 90-degree angle, now you are going to check display the tibia posteriorly. If the patient tibia displaces posteriorly, पीछे की तरफ चली जाएगी और फीमर आगे की तरफ आ जाएगी, तो आप कह दोगे दिस पेशेंट इज हैविंग पॉजिटिव posterior drawer sign is positive. it means he is having any tear in the posterior cruciate ligament. Okay, so this is your anterior draw sign and posterior draw sign. Very important. You all must have to know about it. And what is the Lashman test? Lashman test is the same thing. Okay, but this procedure can be painful for the patient. To prevent that pain, they are now placing the knee at 30-degree angle and check for anterior or posterior displacement of the tibia. So for knee examination, you must have to remember the mnemonic. इसका एक mnemonic भी है. हाँ, ये बहुत दफा पूछा जा चुका है in your examination, so you must have to understand all these things. Okay, so one mnemonic is here. What is the mnemonic? Mnemonic is LAMP. LAMP. Okay, so see here. L is your what? L is your lateral femoral condyle. Okay, lateral femoral condyle to the anterior tibia. Okay, and M is your what? Medial femoral condyle to posterior tibia. Okay, so lateral femoral condyle to anterior tibia, it is your what? It is your ACL. Medial femoral condyle to posterior tibia, it is your what? It is your PCL. Okay, so this is how you are going to remember it. Okay, lateral femoral condyle to anterior tibia, it is your anterior cruciate ligament. Medial femoral condyle to posterior tibia, ये देखें, medial condyle to your posterior tibia, it is your PCL. Lateral femoral condyle to your anterior tibia, it is your ACL. Okay, so this is how you are going to remember all these points. Clear to everyone? This is clear? And one more thing, please remember, on this side here, see this picture, everyone, all students. One thing I want you to remember it for us. See here on this side. A muscle tendon is also present here, and that is your popliteus tendon. So what is popliteus tendon? Here. So this tendon is present inside the joint. So muscles or region or tendon must be outside the joint mostly. But there are some muscles which are present intracapsulary, and one of the muscle which is present here in the knee joint or coming out from here is the region that is the popliteal muscle. That is your popliteal muscle. Clear to everyone? This is clear. This is your knee joint complete lecture and some points. See here. See, this is the popliteus muscle. So popliteus muscle, it is on the lateral side. Medial side, there is no muscle here. Okay. Medial side, there will be no muscle here. Okay. That's why patient develop mostly the medial side injury, and that is known as your unhappy triad. So what is unhappy triad? ये देख लें. Unhappy triad. Unhappy triad means what? There is a rupture of medial collateral ligament, there is a damage to the medial meniscus, and there is a damage to your anterior cruciate ligament.